Hi everyone, I'm Dr. Alison Glass and we're here to talk about cancer awareness. With me today is Dr. Chris Maskey from our molecular laboratory. Chris.
Hi, so we've got Cervical Cancer Awareness Month, and did you know that cervical cancer is the second most common cancer in women in South Africa, and it's the most common cancer in women who are 15 to 44 years old. That means that it mostly affects young women in the prime of their lives, looking after children, and that's the devastating thing about it. But one thing we can do about cervical cancer is prevent it, because we know exactly what causes it. It is caused by a virus called human papillomavirus, or HPV. And we can screen for this very effectively. And by screening and picking up the pre-cancer stages, we can prevent anyone from developing cancer. Just to give you a scary statistic about this, we've looked in our system, and over the last 2 years, we've diagnosed within Lancet 2,000 cases of cervical cancer. That's 2,000 women who've got cervical cancer who didn't need to get it. So let's go forward and let's try and prevent it.
Right, so September is Cervical Cancer Awareness Month. Did you know that 60% of all of Lancet's employees are women? So you are really important to us, and we want to take care of the health of the women working for Lancet. So as part of this, we want to make HPV testing accessible to you. No woman likes going to the doctor for a pap smear, and that's probably why most of us avoid getting screened for cervical cancer. But it is possible to take your own sample for HPV screening, and that's what we want to make accessible to you. And for that purpose, we are partnering with UDoTest, and Alison Martin is with us to tell you more about this initiative.
Thank you very much, Dr. Glass. We're very excited to be participating in this campaign with Lancet this month, and we've been working for the past 2.5 years in helping women in South Africa in detecting this HPV virus. We introduced the UDoHPV test for women over the age of 25. It's a very easy self-sampling test which ladies can do either in a bathroom or from home. It takes 30 seconds to do. Within your UDoHPV test, you will find the Evelyn brush. The Evelyn brush is a dry swab device, and it's easy to do. Basically, in standing position, you will insert the Evelyn brush, remove the lid as far as the ridge here. Once inserted, push the bottom of the Evelyn brush so that the bristles receive your vaginal wall cells. Rotate the brush 3 to 5 times, and then remove it. Put the lid on and put the brush in its uniquely barcoded bag and in its uniquely barcoded test kit. Each test kit is linked to either your email address or your cell phone number. You will also receive feedback from our doctors within 5 working days of your results. We also provide a service with counseling additionally if you need, but ultimately we're providing you with an easy alternative which is available internationally but now available through you.
So samples will be tested at Lancet, but because your kit is barcoded with a unique identifier, none of your personal details will appear on Meditech, so no one else will be able to look at your results. Only UDoTest will have access to your test results, and they will communicate that back to you and provide you with advice on what to do with your test results. So we hope that as many women as possible in Lancet over the age of 25 will take advantage of this opportunity.
So every day, all of you look after thousands of patients within the Lancet organization, giving them quality results. Now, September is your chance to look after yourself. We want to encourage you to take this opportunity to use the best technology on the planet that we have available here for you to screen for HPV, combined with the most user-friendly way of taking a sample that doesn't even require you to go to a doctor. So, this is an opportunity for you to know your risk, to stay safe, and nobody, most particularly our Lancet staff, should ever get cervical cancer. Now, before we finish, cancer doesn't only happen in women. Men are also at risk, and in particular for prostate cancer. So along with this initiative, during the month of September, we will also be providing PSA testing for prostate cancer screening to all men over the age of 40. And we encourage all men over the age of 40 to access this opportunity for screening, to know their risk, and to be able to change the course of their history. Thank you.